Hello friends, welcome to the show Talk with Your Dog. My name is Dr. Prashant Jani. I'm a physician here at Thunder Bay Regional Health Science Centre, Thunder Bay, Ontario, Canada, and I am also Associate Professor of Medicine at Northern Ontario School of Medicine, Thunder Bay, Ontario. Prostate cancer incidence is increasing day by day. The statistics say that 1 in 7 males will be diagnosed with prostate cancer in North America. After the skin cancer, the prostate cancer is the second most common type of cancer in males in North America. And it is also one of the most important factor which contributes to the cancer-related deaths in males. After lung cancer, it is the second most cancer-related death cause in males in North America. It is said that 1 in 39 males will die due to prostate cancer in North America. So we can see that prostate cancer is very significant in our community. And prostate, as you may know, that it is a very small gland which is situated just underneath the bladder, and it is part of male reproductive system, and it is in close correlation with the rectum, and the urethra which drains the urine from the bladder also passes through the prostate. So prostate is a very important organ in our body in the males, and the cancer of prostate is rising day by day. So today in this show we are going to talk about what are the risk factors of the prostate cancer, what are the early diagnostic methods, and what are the treatment options available at this time. With me is Dr. Walid Shahrour, who is a urologist at Thunder Bay Regional Health Science Centre in Thunder Bay, Ontario. Welcome, Dr. Shahrour, for today's show.
Thank you.
Thank you for your time. In my practice, every day I see quite a few cancer prostate biopsies which are positive for the cancer, and you might be seeing the many patients with the prostate cancer. What do you think, what are the possible risk factors which leads to the prostate cancer?
Well, there are many known risk factors. There are some of them that include, for example, the race. We know that, for example, if you are of African origin, you have higher risk of prostate cancer. If you're North American, like white, Caucasian,
yes,
higher risk of prostate cancer. We, like South American, you have higher risk of prostate cancer. But we also see that if you're Asian, for example,
yes,
you have lower risk of prostate,
of
prostate cancer.
Yes.
That's one of the risk factors. Other risk factors would include like having family history.
Family history.
So if you have, like, let's say a father who had a prostate cancer, a brother who had prostate cancer, so these people who are, you would say, in like your immediate family, or like your brother, your father, they increase your risk. To a lesser degree, if you have, like, let's say cousins,
right,
it's not as high.
So it is a genetically linked, probably.
Well, there are some theories, and there are actually some genes which have been identified. We think they have a relationship with prostate cancer. There is the BRCA.
BRCA, yes.
So
it is the same as which is related with the breast cancer.
Exactly. Is it a very strong correlation? Well, there is a correlation, but it's not as strong maybe as the breast one.
Right.
There's also the HNPC, like the hereditary non-polyposis cancer. Basically, it also has a relationship to do with prostate cancer. These are genetic factors. We also can see some correlation between with age, like risk factors is age.
Age, yes.
So I always tell my patients, you know what, when you're 30, your chances of having prostate cancer are extremely rare, while when you get older, the older you get, the more the chance you're going to have prostate cancer.
Yes.
As a matter of like the prostate getting probably the constant exposure, with time it will eventually have.
So you think like it is rare before the 40 years of age, and it increases after the certain
rare.
age?
Although we always say, you know what, if you want to think about the incidence of prostate cancer, you always think about it age. So if you have, like, let's say you're 40, there's 40%, but doesn't mean that this is a clinically significant cancer.
Right.
So we have to identify we have to make a difference between what is clinically significant and what is not significant.
Right.
Because if you take a prostate of a 50-year-old male who, let's say, passed away from some other cause than prostate cancer, and you do the do biopsy and you check like under the pathology with the
Yes.
pathologist, you will find like small focus of prostate cancer probably in 50% of these of if you get 10 patients
Yes.
with the same age, you'll have 5 of them having
So
prostate cancer.
asymptomatic cancer will be there, but it won't be clinically significant.
Exactly.
Yes.
Exactly.
Do you think diet is related with the cancer?
That's one of the most common questions I always get asked. Like, oh, is there something in my diet? I can change something. There are theories behind it, but I have to say they are weak.
Okay.
So they think, for example, if you have high fat diet,
yes,
this can increase
risk
your risk of prostate cancer. Although I have to say the science behind it is not that strong, so it's not really a way to say, oh yeah, you know what, this is a preventative method.
Okay.
To
I have read that maybe red meat diet is associated with the increased risk of prostate cancer, and people who eat less fruits and green vegetables have risk. What do you think about that?
Well, it goes, I think, under the same
Right.
umbrella. You know, like, you know, if you're eating a lot of red meat, they think that, you know what, the studies have shown there's some correlation. But the thing is, it's very hard to pinpoint the cause. And and just because they're both happening, it doesn't mean it's a causative agent.
How about smoking exposure?
Smoking has been shown
is associated
to have
risk?
some, but it is not, for example, as strong as a correlation, for example, between smoking and bladder cancer or lung cancer.
Correct.
So
there is small risk increase.
There is a small risk, but it's not as strong as a correlation as other agents.
What do you think about the sexually transmitted diseases and prostatitis, infection of prostate? Do you think those are related with the prostate cancer?
It's a very weak correlation.
Okay.
There was actually in the past, there used to be like, vasectomy, for example, used to be one of the risk factors thought to be for prostate cancer. But right nowadays, there are many like publications coming out saying, you know what, it might not be the case. Okay. So whenever like if we have a very strong correlation, we know, like, for example, as we said, family history, this is a strong correlation and we can see it. But when then you go for the diet or exposure, there's some correlation, but it is not very strong. So it doesn't become as a strong evidence.
So what do you think, what causes the prostate cancer? Is that all these risk factors leads to some sort of genetic alteration in the cancer cells, prostate cells, leading to cancer cell formation?
That's $1 million question you're asking here, because, you know, whenever anyone tells me, like, how did this happen? Like, you know what? We think it's from the DNA. We think it's basically like your DNA is basically how that's the coding, how we are coded.
Right.
And if there's a problem with the coding, after a while, it basically leads to the cells becoming abnormal. I tell the patient the cells become crazy.
Right.
And they start like multiplying and multiplying in a crazy way. But this is the theory behind it. Some people say, oh, you know what, it's just the age. With age, you get some. It's not like that you're inheriting the DNA. It's just a damage in the DNA. So it's rather than inheritance, it's more of an insult that happens, and then because of this insult that happens to the DNA, then you start developing the cancer. Right. These are two theories behind it.
Thank you for explaining that. We'll take a short break and we'll come back to the next part, how to prevent and diagnose the cancer at early stage. Please come back.